Now, throughout the outbreak, we have been profiling some of the people who are working under dangerous conditions to keep us healthy. Tonight, we are looking at the critical job of respiratory therapists. Alicia San spoke with some of these frontline healthcare workers about their role and how it's changed during COVID-19.
The ventilators don't run themselves.
So we'll look at pressure.
It's a respiratory therapist's job to keep you breathing.
Once it goes into the patient, it fills their lungs, and then they blow it out through this white line here, which goes into N100 filter, or any sort of particle, virus, infection gets filtered out in there, and then the flows are measured through this flow sensor. From
there are 3,700 respiratory therapists in Ontario, and since the influx of COVID-19 has slammed the healthcare system, these specialists have been working round the clock. The job is the same, but the demands are different.
It's not something that's new to respiratory therapists. We respond to cardiac arrests and we respond to emergencies all the time to do with the airway. That being said, when we're looking at COVID, it's the unknown. So we're really actually concerned about how do we ensure that we're giving the patients the treatment they need without risking infecting others. So our colleagues, as well as the rest of the healthcare professionals in the room.
The more information we have. So
that goes for intensive care units to birthing rooms.
We're using proper PPEs within these deliveries, within these ORs, just to ensure safety for staff, for mom, for baby, and for everybody, to be honest. So it is an additional level than just a regular delivery, for sure.
There's obviously
home visits from respiratory therapists are more often conducted by video calls these days.
So if I had a elderly patient on the phone, I would also ask about additional things that maybe I might not have before, making sure that they have access to reliable housing, make sure they have access to their medications. Maybe someone's lost their job and they can't afford their inhalers. So I would try to get them samples of inhalers or something like that. So it's an all hands on deck situation, but in a different way.
The province has increased its supply of ventilators. Ontario ICUs now have nearly 2,000 beds equipped with one. But it's not just the breathing machines that are needed, but their parts.
This equipment here that gets thrown out is considered consumable equipment, and that's one of the concerns in the RT community of being short on equipment like this. Ventilator tubing, humidification, and filters. They're important in protecting staff going into these rooms while these ventilators are running, and they're a necessity as well with treating these patients.
Take it from them.
We're the ones who are specialized with the ventilators. We are the ones who help insert and assess and maintain airways.
While the government scrambles to secure more ventilators and our respiratory therapists work with what they've got, they ask one thing from us.
The best thing you can do for us is stay home. I understand that it's being bored at home. It's not going to be ideal. A lot of our patients wish they were in that situation, but they're not, and at the other side of the door.
Alicia San, CBC News, Toronto.